From high atop Healthcare Hill in Central Maryland, this is BSN Headline News. Today's top story is Secours St. Francis in Greenville, South Carolina, is named as one of America's 100 top hospitals by Truven Health Analytics. Truven Health Analytics has been delivering unbiased information, analytic tools, benchmarks, services, and related expertise to the healthcare industry for more than 30 years. They collaborate with customers to uncover and realize opportunities for improving quality, efficiency, and outcomes. Annually, they compile a list of the top 100 hospitals based on study results that analyze hospitals on overall organizational performance as well as long-term rates of improvement. The 2015 study evaluated hospitals on 11 measures: risk-adjusted mortality index, risk-adjusted complications index, risk-adjusted patient safety index, core measures mean percent, 30-day risk-adjusted mortality rates for acute myocardial infarction, heart failure, and pneumonia, 30-day risk-adjusted readmission rates for AMI, heart failure, pneumonia, and hip-knee arthroplasty, severity-adjusted average LOS, case mix, and wage-adjusted inpatient expense per discharge, Medicare spend per beneficiary index, adjusted operating profit margin, and HCAHPS score, patient rating of overall hospital performance. When asked about the recognition, Chief Executive Officer of Secours St. Francis, Mark Nance, is quoted as saying, "This award is a huge win for not only everyone who works in our healthcare system, but for our patients as well." Truven evaluated our leadership teams, medical staff, and employees and concluded that we achieved national benchmarks for balanced performance in patient care, operational efficiency, and financial stability. To receive this kind of recognition 2 years running is truly a distinguished honor. Interestingly, the study shows that if all hospitals in the U.S. performed at the level of this year's winners, 126,471 additional lives could be saved. 108,926 additional patients could be complication-free. $1.8 billion in inpatient costs could be saved. The average patient stay would decrease by half a day, and episode of illness expense would be 2% lower than the peer average. Please join us in congratulating Secours St. Francis in Greenville, South Carolina, one of the 100 top hospitals in America, as objectively evaluated by Truven Health Analytics for the second year in a row. In other news, in the innovation category, ultraviolet disinfection and robots. Secours Mary Immaculate Hospital has an innovative way of protecting patients from hospital-acquired infections. It's called the TruD Smart UVC robot. The TruV Smart UVC robot is a fully automated disinfection system that is activated by a wireless remote control to deliver a dose of UVC light energy that destroys the DNA of germs and pathogens. Once placed in the room, it analyzes the unique variables of the room and floods the space with the proper dose of UVC light energy, also known as germicidal UV, Germicidal UV is known to destroy bacteria, mold, viruses, and other biological contaminants in the patient care environment. A typical patient room or operating room is disinfected in 15 to 25 minutes depending on the configuration of the room and furnishings. TruD reportedly achieves a 99.9% disinfection rate of all viruses and bacteria. Interestingly, while organisms can adapt to chemicals and drugs, there is no known organism that can survive a lethal dose of UVC. Innovation, robots, and good help to those in need. Finally, population health. It's an idea whose time has come, but for many the idea of population health is difficult to wrap our heads around. Nevertheless, Secours recognizes that population health is critical in tomorrow's healthcare world. According to Dr. Thomas Auer, CEO of Secours Medical Group in Richmond, Virginia, we're very dedicated to population health and the transition to a different view on how particularly primary care than specialty care is used and interacted with the community. It all starts with advanced patient-centered medical home, finding the patients that we're not seeing and getting them in for care. But how do we find the patients we're not seeing? Enter informatics, the science of processing data for storage and retrieval, or information science. Secours uses our electronic medical record system, we call it ConnectCare, from both the inpatient and ambulatory perspective to better understand the whole complete patient picture. Secours Informatics mines data from multiple streams and various diagnostic codes to identify gaps in developed risk categories and then communicates that information to nurse navigators, who in turn contact those at-risk patients to address the gaps. Now, this might be a bit of an oversimplification of a complex process, but if we can't get your head wrapped around population health, we can't get to our next point, which is, want to know more about population health and informatics? Why not check out the latest Good Help ACO newsletter? I'm just saying. Well, that's it for this week. Stay tuned to this portal for future up-to-the-minute information on these and other stories on BSN Headline News. I'm Dave Schlachter. Thanks for joining us. BSN Headline News is a production of Secours Productions and is solely responsible for its content.